So, Ms. Watson, then, how is sleep apnea treated? You've determined that I have it. I have moderate sleep apnea. What are my treatment options?
Well, the tried and true treatment is CPAP. That is what we call the gold standard, which means that's the one everything else is measured to. We know that CPAP works. And how that works is you have put an interface on with the CPAP, as is behind me here, and it blows air into the airway to open up that airway that I told you closes. Now, we set the machines usually on a auto PAP, which means we set it, say, 6 to 16. That's what we do here, which means that we'll set what they call a ramp, because people will hear what a ramp is, and that will give you about 20 minutes to get to sleep. So for the first 20 minutes, it'll blow at like 4 centimeters of pressure. After that, it will determine how much pressure it needs to blow to open up that airway. And it can go anywhere from 6 up to 16 centimeters of pressure.
So to jump in real quick then, so the machine determines how I'm sleeping and how severe my sleep apnea is becoming, and then it adjusts to put the necessary amount of air into my airway to keep me from experiencing difficulties.
Absolutely.
Okay.
Yeah. That's the #1 way to do it.
Okay.
Now, the #2 way is an Orbital Appliance, which is usually reserved for people who are in the mild category of sleep apnea. And in that case, what happens is there's a mouthpiece that is fabricated by a special dentist that will mold all of your teeth, and the appliance goes into your mouth when you sleep at night. And there are keys that you can kind of push it forward. And the whole point is to pull your jaw forward a little bit like this so that it opens up that posterior airway a little bit and the air can get by. It tends to be pretty effective for mild sleep apnea.
Okay.
And of course, it's very convenient because you don't have any tubes or interfaces on your face during the night. But you know, you do have to have it fabricated. It lasts about 5 to 6 years before another one has to be done. And the VA does cover this.
Okay.
The last one, there's one more thing.
Okay, awesome.
There's another thing. It used to be called Provent. Now there's a new one, and it has a funny name, guys, called Bongo. It's kind of new on the market, and it works through the nose. It's like little patches that you put on your nose. It has a special valve in it. And when you breathe, as long as you're not a mouth breather, if you breathe with your mouth closed, it'll cause a little back pressure when you exhale and open up that back airway.
Okay. All right.
Not as effective. Most effective CPAP. Oral Appliance is pretty good for the right person. I would never use it for somebody who had severe sleep apnea. Or the Bongo, again, usually in that mild or early moderate category.
All right, so that was going to be my question. So if I have mild sleep apnea, then I have some choices. But it's from what I'm understanding, if I have moderate to severe, then you're giving me a CPAP machine, like it's off your right shoulder there, with the hose and the face mask. And I noticed there's 3 different types. Can you just talk about why there's 3 different types and what they do?
Sure. A lot of people like to start off with the nasal pillows, which just fit underneath your nose.
Okay.
Because they're not covering your whole face. And this blows the air up through the back of your nose into your throat. But the caveat is you have to have your mouth closed. Otherwise, if you open your mouth up, it's going to come right out of your mouth. And then it'll wake you up and it'll bother people. So as long as, and we do have a chin strap that you can use that sometimes helps, but many times we have to bump you up to a full face mask so that covers everything.
Okay, so
especially if you're mouth breathing.
So if I'm a mouth breather when I sleep, then I'm getting the first mask right here, which is, it looks like it's a full face mask. Okay. The middle one looks like it just covers your nose, but it's not the pillow one that you talked about.
That one is for people who maybe don't like that sensation of having something right near your nose.
Okay.
And they rather have it over their nose because it's not actually touching the nostrils. Some people, if it blows a certain way, it might irritate their nose. We do have special cones that we can use to put in your nose for that, but sometimes people just don't find it comfortable. And we're highly invested in all of our veterans being compliant with their CPAP. We want you to not be sleepy. We don't want you falling asleep at the wheel. And we don't want you having those complications years from now that, you know, we treat you now so we don't have to treat you for those other things later.
That makes perfect sense. And so I would also imagine, though, as if I'm new to this, you know, okay, I've been diagnosed, I have moderate sleep apnea. I now come back and see you. I'm going to be issued a CPAP machine. You know, I'm assuming you guys show me how to use it and how to clean it and all that. And then do I go home and kind of experiment with what mask I think works for me? And then can I come back and say, I don't like that one. Can I try this one? How does that work?
Well, here at the Providence VA, we have a vendor that actually goes to your house, measures you, asks you some questions like, are you a mouth breather and certain other things, and tries to determine which one would be best for you, which one of the interfaces.
All right.
And then they will fit it. You'll give it a try. Usually within 10 days or so, they'll check back with you to see how things are going, because sometimes right away, you know, you don't like something and you can exchange it. Otherwise, we have follow-ups with you. Like typically when someone is diagnosed, I'll be seeing them within maybe 4 weeks. And then when you come in, I'll do a download and say, how are you doing? And so that's your first contact with how are things going.
Okay.
And then there will also be a respiratory therapist that will do a face-to-face visit in about 8 to 9 weeks. And again, a download will be done and another troubleshooting to see how things are going.
I guess my last question then about how we treat. Is there a surgery option? And I guess my question for that is if you're real severe, is there surgery that can be done or not? Or can I elect surgery so I'm not wearing a mask for the rest of my life? Are there options along those routes?
I'm so glad you asked me that, because I do get that question quite often. And years ago, like 20 years ago, there was a procedure called UPPP, uvuloplasty, where they would take your uvula out and sometimes even take away some of the tissue in the back of your throat. And it would help usually with the snoring. It was kind of a 50-50 thing as to whether it would actually help your sleep apnea. I can tell you I have many of my sleep apnea patients that have had that procedure and they still have sleep apnea, okay? Now, in the newer world, nowadays, there's also something new on the market called Inspire. It is a device that's implanted into your abdomen, and it has wires that go up into the side of your throat, and it stimulates those muscles to prevent your tongue from going backwards and obstructing the airway. It's a relatively new procedure. It's not done here in the VA. It's done at an outside community. It is reserved for severe sleep apnea that is unable to tolerate any of the things that I discussed earlier.
Okay.
And it doesn't come without risk. I mean, it is
It sounds like it's major surgery.
It's major surgery. It's an implantable device, which means that if you had an infection in your body, it may go to that site and may seed there and then have to be removed. So, people think it's a quick fix. It's really not. It's quite an invasive procedure, but it can be done, and it is appropriate for certain individuals.
You have questions? We have answers. The SITREP is your trusted source for veterans benefits information with expert analysis and interviews with leaders from the field. To find past shows, podcasts, and other content, search #TheSITREP on YouTube.